Hi, and welcome back to Accent Your Beauty. This week, you're going to love our show because we're going to get to some of your questions and we're going to give you some answers. Dr. Berkowitz is always here to give us our perfect answers, and Silvia's back, and we love when Silvia's here. She's the best injector on the planet because you learn from the best, so I guess we can attribute that to your expertise. But we're going to have some question and answers that some of you have either texted to me or sent into the offices by email or by phone. And we're going to start out by a question that we sort of answered last week, but for those who didn't watch last week, a friend of mine wants to know, she heard that Juvederm is the best filler for lips. So she wants to know why you would recommend Volbella. And we kind of talked about that, but explain it again.
Yeah, so just depending on what the patient is looking for and what's going on with their lips in this case, we recommend the appropriate filler. So choosing Volbella over Juvederm, if a patient comes in with fine lines, sometimes an older patient that doesn't really need that plumpness that Juvederm will give you, Volbella is better off for them. Sometimes even someone younger who comes in with very thin lips, I like to start off using Volbella and kind of building from there.
And what's the difference in cost between the two products? Are they similar?
Volbella is a little bit less. It's $500 a syringe. Juvederm is $660 a syringe. $660 to $760.
Now, do you blend them both together? Could you buy like a syringe of each and kind of work them together?
You could, yeah. We wouldn't necessarily blend the two fillers together, but we can use
Why don't
them.
we mix them together in one syringe? But inject them both.
Yeah, so Volbella we can use to kind of define the border of the lip, and then Juvederm we can use in the lip to plump it.
So they're cousins, and basically they're nice, soft fillers. What's beautiful about Juvederm, and that's normally where we start for most people with Juvederm, is that it likes water, and so it gives them more of a luscious lip. And so it's nice to give a fill, especially to the red of the lip. And then with Volbella, it can be used in that area too, but it's nice to define with Volbella and go after some of the fine lines on the white of the lip, build the border as well. But sometimes we don't need a full syringe of Juvederm, and Volbella, what's nice about it is that it comes in half syringes as well, and so we can take smaller steps with it.
Well, that's good to know because I always wondered what do they do with the leftovers because you don't reuse it on another
It's not like
patient.
food. There's very few leftovers in the cosmetic world.
I mean, you want whatever you're paying for, you want it in there somewhere. Find a place for it.
We can always find a place for it.
Now, it's gotten a lot less painful than it used to be. I remember at the beginning when people started injecting their lips, I used to hear horror stories about how much it hurt. Now, I see people getting it all the time and they look very comfortable.
Yeah, the majority of these fillers have lidocaine built into them, so that's what numbs the area. And then we also have patients ice prior to an injection too to help keep them as comfortable.
So we have certain little trade secrets that we keep. So things like ice, but we put ice into a balloon so it contours to the face better. And then we give our clients gloves to hold the balloon with. And that way their hands aren't freezing, and so they can hold the balloon there a bit longer as well. We can place also freezing creams around the area too. If people need it, we do have a system called Pronox, which is the ability to breathe in nitrous oxide. You can't do it at the same time as we're injecting the lip, but right before or after.
Does it last long enough that if you take a nice deep breath of it, it'll make you comfortable for the next couple injections, then you take another whiff of it?
Correct. And then the beauty of nitrous oxide is it's gone afterwards, so you can drive yourself home.
Is there an extra charge for that if you want that, or is that just a service that's offered?
It's a service that's offered.
Yeah. Well, that's nice. I think I'll come in just for that. Okay. Next question, and I guess this is for both of you. Somebody said that this was an email. I was getting Botox at another office, and they were suggesting that I use less than what you're suggesting. Why would they suggest a smaller amount than what you're suggesting?
So I always approach a patient as it's a new patient, so we do a consultation from beginning to end. I address their concerns, and of course I also give them my input. So with Botox, for instance, patients sometimes need to be educated on the product and exactly what it does, and it's kind of based on our expertise as well. So I make sure to keep them comfortable. I tell them that we don't do we keep things conservative. We inject conservatively. We try to keep things looking as natural as possible. But at the same time, we want it to be an effective treatment for them. So other offices, yes, may have suggested less, but they may require more. But we still keep it as conservative as possible.
Yes. So first of all, sometimes there's a little bit of a mix-up too. We're not always comparing apples and oranges. So sometimes people come in, they're saying, oh, a syringe is less at X, Y, and Z, doctor. Well, a syringe of Botox can have 1 unit in it, can have 100 units in it. And so people don't always know what's in the mix.
That's not standard. The syringe itself is not a standard amount in it.
Correct.
So you have to know what you're getting.
Correct. And so, we usually have a mix where there's somewhere between 12 or 15 units within a syringe itself. Others may have 4 units in a syringe, or they may have 12 or 15, but so you have to ask, how many units am I receiving? My preference is really to inject what the person needs without looking at the number of units, but people, they've been taught to ask, how many units, because they've gone to another doctor and another doctor has said the number of units. But my feeling is, if this is what you need to soften your face, then if I give that to you and you accept that and you need more, I don't charge you more when you come back.
Oh, okay, that's good.
So I include that, knowing that if my plan is that I believe that 40 or 60 units will make the change for you, and then we see you back with 2 or 3 weeks and we see that you need more, if you followed my regimen, then I don't charge you more to go ahead. While others may give a price that's lower or say the number of units that's lower, knowing that the person's going to have to come back and then charge them for more units.
Also, I think there's a bait and switch thing that goes on with some doctors where they tell you, yes, I think we can do 1 syringe for $500 or whatever the price is. Then once you get in and you see that's not giving you the results you want, then they start adding on
I hope not.
upcharging.
We try to let you know exactly what we think is going to be best for you. And you can pick the plan or not, but we want you to know why we've come up with this plan. And so we spend a lot of time educating so that people know exactly what we think, why we think it, and put together the plan. And, our name is on your face, and so we won't let you do something wrong, but we'll guide you in what we feel is what's best for you.
And people need to know really what they're getting. Like you said, a syringe is not a syringe is not a syringe. So you need to make sure that what that doctor told you is exactly the same as what you're telling them.
That's correct.
Okay, the next question. Somebody asked, will their wrinkles come back worse if they don't continue getting Botox? In other words, if they get it and then don't get it again, will they get deeper?
Yeah, so that's a very common question we get in the office. So I tell patients that the best way to work with Botox is to maintain it. Come back in every 3 to 4 months for your treatments. That'll keep your lines as diminished or faded as possible, and then prevent further lines from forming. If you were to stop getting treatment, what you will see is what you started with. If, for instance, you just chose to not do Botox at all anymore, 5 years down the line, as we all know, we continue to age. So yes, of course, we're going to continue age, and your lines in 5 years are not going to be your lines now.
But they're not worse because
They're
you
not
stop
worse
it.
because
There's not a
Not
buildup
at all.
waiting saying,
No.
you tried to fool Mother Nature,
No.
and we're going to get back at you.
Right.
So the person who's getting ready for the bar mitzvah or the wedding, who says, you know what, I only want to do this one treatment, whether it be filler or Botox, they can have the one treatment, get the results they're looking for it. It doesn't mean they have to keep coming back for maintenance. they will just continue to age as they naturally would, and it will slowly dissipate over time for them.
Okay, here's another one for both of you. Similar to the last one, but a little bit different. If I get lip filler and then I stop, will my lips be stretched out from where the filler was and now it's not there?
No, that's not possible. They just go back to what they were. That's that.
So stretching it out, they have the elasticity to go back to where they were
Right.
without, because a lot of
Right.
times when you lose a lot of weight, the skin doesn't get back to where it
But
was.
that's exactly it. It's a lot of weight. It would have to be a lot of volume put in. And for the most part, we're putting 1, maybe 2 syringes over time. So that's 1/5 of a cc, 1/5 of a teaspoon, I should say, and most maybe 2/5 of a teaspoon. So you're not putting a lot of stretch into the lip. So you're not changing the shape of the lip that it can't come back to where it was, and it will slowly dissipate over time. You don't have to worry, as if somebody put plates in your lips and made this big stretch for you. So we'll go back.
Okay, another question about Botox. Some offices supposedly dilute Botox, like a bartender diluting a drink, putting more water than the actual alcohol. Is that true? Can you dilute it?
Well, I wouldn't really necessarily speak for other offices, but
I mean, is it possible to dilute
so
it?
when we receive Botox, it's in a powder form in a vial, and in order to get it into a liquid form to inject, there's a protocol you follow, and there's a certain amount of normal saline, basically, that you are reconstituting that powder with, just mixing it. We follow the protocol. We place exactly how much the company recommends. Some offices may put more or less. I don't know, and I wouldn't want to really speak for other offices, but there is a protocol to mix with saline in order to get it from that powder into the liquid.
Right, so that goes with the earlier question of the syringe, how many units are in there. So they can reconstitute it by putting more normal saline, which is salt water, into the syringe. And in putting more in, that can dilute it. And by diluting it, then you can have 1 unit, you can have 2 units, but most places are putting somewhere between 12 and 15 units, unless specifically for purposes of a dilute solution.
So it is possible.
Mm-hmm. It
It
is.
is possible.
Now, would that be, excuse me, I know it's not illegal, but that's unethical.
Unethical. Yeah, that's
Well, it's unethical if they're not telling the client. They should be telling the client, these are the amount of units. They really shouldn't sell it by the syringe. You see that sometimes with Groupons, a syringe of Botox, but you don't know what's in that syringe. So
Wow, I never thought about that. So they could actually mark it down by using less of the powder and more of the saline.
correct.
So you're getting what you think is a syringe, but it's more saline
Correct.
than if it was the fully concentrated.
Yeah, that's
So
possible.
how does the consumer know? I mean, you can't ask the doctor.
You can,
it-
you can, you
Oh,
should,
so you could ask.
You should be an educated consumer. You should ask. Not only should you
I
ask,
wouldn't even have thought to ask that question.
but the problem is people don't ask that question of how many units are they receiving. They should ask that, or if there's trust of the doctor, basically the doctor can just put together a plan saying this is the treatment that you need, and that's why we try to put it that way so that if we see you need more, and I said it's this amount you need, I will always give you more, and there's no charge for that if you need it. But people don't ask a lot of the questions they should, like who's injecting me? They'll go into a doctor's office, and it may not be the doctor injecting them. It may not be the nurse injecting
Well, that's a
them.
great question. Is it in some way governed that a person that's doing injectables has to have a license,
It's
has
state
to
by
have taken
state.
a course?
It is state by state. And so there are some states that dictate 100% that it's the doctor or it's a nurse. Michigan, some of the laws,
Can it be an esthetician, someone that does facials can also inject?
it can be, but not at my office.
Well, that's good
Yeah,
to
yeah,
know,
yeah.
but it is possible. And that's why I think that as a consumer, when you go to any kind of a clinic or a doctor, even a facial salon, find out the qualifications of the person that's putting something into your skin, because you don't know what you're getting if you don't ask. I did not know that it came as a powder and had to be mixed. I assumed that it just came as a liquid and you put it in the syringe and you injected it. So I think that's important that people
I mean,
ask.
if people really want to push the point, they can ask, I want to see you, reconstituted in front of me.
Oh,
You can-
really? Who
you-
would even
you-
think
right-
about that? But
Right. But that at that point there's such a distrust,
Right.
Right,
that
right.
it forms a bad,
well, I
client.
don't think people
doctor-
even would know that it's a product that can be diluted. I certainly didn't know that. Somebody knew enough to ask. But again, if you're going to an ethical place like your clinic, that's never going to happen. And I think that it's about price. Maybe they're trying to save money. Why not just use a little less this time rather than dilute it? Well, we're going to be right back with more questions and more answers for you. We'll be right back.
Low budget movie version.
60s TV version. Early 2000s high school pseudo-adaptation that eventually grows into the geek we all know and love version here. I'm getting paid a lot of money to be here, so listen up. Watch the Geektainment channel on newradiomedia.com. It's geek approved. It's all about you, and that's the way we like it.
Where you're going,
What you do to stay fit.
what you're eating.
What you're thinking?
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Hey, you guys, it's Raphael of the Teenage Mutant Ninja Turtles. Guess what? The only thing we can get down here in the sewer is Geektainment Weekly on New Radio Media. Turtle Power!
I am so excited about this segment. I'll tell you why. I've always been like a little product whore. I would have drawers filled with, well, it's true. Drawers filled with this cream and this product, till I met you guys and you got me on the right track with the right products. I had drawers full, and it's a waste of money. Silvia's going to tell us about a wonderful product that you can throw away your drawer full of stuff and stick with this wonderful product. So tell us about it.
Yes, and I understand when people try all different types of products, and we do have a few different lines in the office, and we also, depending on what your goals are and what your concerns are and what you need, we can mix different lines. But I love the Obage line, specifically these kits, because again, depending on your skin and your needs, it's already customized for you, and it just comes as a kit. So each kit comes with however many products you need for your concerns. The one right here, the yellow one, is the vitamin C kit, and the one in the back is the New Derm kit. The vitamin C kit, excuse me, is more for brightening the skin.
Well, let's talk about it. How many products are in the kit?
This one comes with 5 different products. It comes with a cleanser, a serum, a toner, a moisturizer, and a sunscreen, which you should be applying all year round.
A question about that. The serum. a lot of people don't realize that goes on first in most cases, correct?
Yeah, in most cases, the majority of cases, you put on a serum first, including in this case. After you cleanse your skin, you tone it, you use the toner, and then you place the serum, and that'll help the moisturizer absorb better into the skin as well.
What makes this product line so good? Because Dr. Obage's been around a long
Yes.
time, so obviously his products
Very
work.
well known. Yes, his products really do work. I like to think of them as more corrective products. When you have concerns, for instance, someone that would need this yellow kit, maybe have dull skin, need some brightening, or just overall rejuvenation, that's a really good kit to use. It comes for, or you can get it for dry skin, normal skin, oily skin. It all depends on your skin. There's one or two products that are a little different depending on what type of skin you have.
Now, you don't sell the individual products. You sell it as a kit, correct?
Certain ones you can sell as individuals, but we have the kits. They
Now,
work
how
well.
much is the yellow kit?
The yellow kit is $374, and again, that's 5 different products, and it would last you a good 3 months.
See, that's the question everybody asks. After they ask how much it costs, they want to know,
Yeah.
how long is that going to last me?
5 products, that'll last you a good 3
Yeah.
months.
And should you use one product faster than the others, most of them you can get individually. You know, should that
Like
occur
the
without
cleanser, you can purchase it separately as well.
Okay, and you recommend that line for all skin types,
I would
right?
recommend
There's
it for-
different
yeah.
products for different skin types?
I would recommend it for all skin types, mainly for those just looking for overall brightness and just almost kind of maintenance of the skin after the summer, maybe just to brighten, or even before the summer to brighten. It's safe to use during the summer because it doesn't contain any ingredients that make your skin more sensitive in the sun, whereas this product, this kit right here contains a product that has hydroquinone, and that makes your skin a bit more sensitive to the sun. So
we all
you'd
know
want to
we
use it
shouldn't
more.
be in the sun a lot. Anyways,
Anyways,
without
yeah.
sunscreen.
Right, and both of them do come with sunscreen.
And I can't emphasize enough, and you'll back me up, Doc, the sun ages you. There's no way, it feels good, everybody loves a tan, but
Yeah, the tan today is unfortunately either the skin cancer tomorrow, the breakdown of collagen tomorrow that you not just want but need procedures to reverse the sun damage that's there. So, 10 minutes a day of the sun is what your body needs. Past that, you're putting yourself at risk.
and it's a shame because in the last 50 years, it's come around because when I was younger, tans were the thing. Everyone got as dark as they could get. Baby oil, iodine,
Mirrors.
reflectors. We used to take record albums, open them up, put aluminum foil, and hold them. That's why I've had 3 skin cancers. But I always like to throw that out there for people. Be very careful in the sun. It feels good, but you'll pay for it later. So these products will help reverse sun damage.
Definitely the new Derm Kit will help reverse sun damage.
And what's in that kit? It's a bigger kit, so it must have more products.
There's one other product. It's the hydroquinone product that's in there. That's the additional one. That kit runs for $453. It also has a cleanser, the hydroquinone product, a toner, a serum, and the moisturizer as well.
So is it basically that same kit, but with one extra product?
Yeah, different ingredients in some of the products. The moisturizer, for instance.
So the hydroquinone, what that does is in the skin, there's something called melanin, which makes the
That's
skin
makes the
darker.
color, yeah.
So the hydroquinone helps to block that reaction, so less melanin is being made. And that way, when you're turning over the skin, you can get rid of some of the brown spots that are there,
So
dark
the liver
spots.
spots, the age spots, the discolorations. Do you recommend that during pregnancy? Because a lot of
No.
girls get discolorations during
No.
pregnancy.
Yeah, so
No?
so during pregnancy, there are very few products that are safe, and hydroquinone is a product that we would not have used during pregnancy.
That's why I asked. I just want to make sure for anyone that's watching that's pregnant, because your skin does get a little discolored sometimes from pregnancy. But don't use that.
Yeah, so we have a line that is purely natural called Airel, and those products can be safely used during pregnancy and can help reverse sun damage as well. And so,
Now, do you recommend that you use these products in conjunction with fillers, skin resurfacing, vampire facials? and other procedures as a package, that once you've resurfaced the skin, you want to keep it looking good. So do you suggest that you use these products in conjunction with other treatments?
Absolutely. Some of the products we recommend to get you ready for a treatment, such as laser resurfacing. So some of it prepares you for it, and others are to maintain it.
Right. So there are some products we'll have you use beforehand, like the hydroquinone, before resurfacing. Sometimes we integrate other products as well, because right after a resurfacing, if we're going very deep, we may hold off from all of these products and just have you on, a bland, calming product for your skin, and it may take a week or two before we get back to some of these, but it really depends on how we've customized things for you as far as the resurfacing.
Well, that's the beauty of your office, is that your staff is so knowledgeable about what you need and when you need it, what to do before a procedure, what to do after the procedure, how often to come back. That's why a client of yours knows that they're getting the best advice on the best products, and that's very important. We have some more questions for you, or either one of you who want to answer. They come in while I'm sitting here. Okay. Is it possible to transplant body hair from the chest, the arms, other parts of the body to the head?
The answer is 100% it is, but we only go to those other areas when we've used up the supply that you have naturally. So the supply we use first is the area in the back of the head and over the ears, because that hair reacts differently to the hormone DHT than the rest of the hair. So you can transplant that and it will continue to grow. Once someone does not have a supply anymore within that area, we will go either to the beard or to the chest as far as that hair. And that hair over time will actually take on the character of the surrounding hair. But it's more time intensive to move that hair. And so in a time where we can transplant, let's say 2,500 hairs from the back of the head to the top, from somebody's chest or beard in that same time period, because it's labor intensive, we may get 500 to the most 1,000. So it's more expensive to have that procedure to move body hair. And that hair, again, takes time before it can build on to the same character. And it doesn't always 100% do that.
So different parts of the body, the hair grows in a different pattern?
Different pattern,
Is it different thickness? Is it different texture?
And its sleep pattern may be different than the hair on top of the head. Hair always goes into a sleep cycle as well. And also the length it can grow may be different too. But we don't take usually from the arms or legs.
Well, that's
It's usually,
really fine,
it's,
hair.
it's usually chest or beard hair.
Well, that's such an interesting subject, because I've noticed sometimes you'll see a man, he's got straight hair, nice slick back hair, and his beard's all curly and gray. And it seems like the beards get grayer before the other hair.
It catches up.
And it looks, but it looks different. It looks like different
Yeah.
hair. So I would think the best is to take from the hair
Yeah,
on the back and put it in the front, right?
that's the best.
Okay.
And by the way, since other people do ask it, you can't get hair donated from somebody else.
Oh, I hadn't even thought about
Right.
that. So you can't use like cadaver hair.
You can't use cadaver hair. You can't use
Because you can use
your
other parts of
sister's
the-
hair. You know,
So it has to be your own.
it has to be your own,
or it
otherwise it'll
won't-
be rejected.
That's a great question. I didn't even think about that. One more question before we go to break. What are the options to fix an uneven eyebrow? That's one's higher or lower. They're uneven.
Well, you have multiple options. You can do something like Botox. It can help slightly lift the area, the brow, depending on how severe it is. Also, filler you can use, or you can go into surgical options as well.
Yeah, so there are many things that can be done. And with Botox, we have the option of trying to lift one side or make the other side fall down, depending on what look the person is
So
trying
if
to
one's
achieve.
too high, you can lower it and not necessarily raise the other one, because then you might have two of them that look too high
Right.
and you look surprised.
Right.
Wow, that's all good stuff. I was going to ask you also, Botox for headaches, yes, no?
Yes.
Yeah.
I've had patients who have, it's really helped their headaches, just using it for cosmetic purposes.
So it's FDA approved for migraines, but there are people, as Sylvia said, who come in for Botox for cosmetic reasons, and they don't even realize that they're also getting a treatment for their migraine. Then they come back a few months later and they say, by the way, my migraines got better too.
Yeah.
Wow, that's another benefit to Botox. It's the wonder drug of our ages. Anyways, we're going to take a break. We're going to be right back with more questions and answers with Josh. We'll be
And action. And millions of ducks. The two guys go to newradiomedia.com.
The Arts and Entertainment Channel on New Radio Media .com.
As a business owner, you're always looking to save money and cut costs where you can. And if you advertise on radio or television, you know it can get pretty pricey. If radio and TV aren't delivering like they promised, and you're looking for a more reasonably priced way to get your message to the masses, I've got an answer for you. New Radio Media. With live streaming and on-demand programming, your message can be seen throughout the day, and you can worry a little less about cutting those costs. For more information, go to newradiomedia.com or call Buzz Van Houten at 248-939-9999.
Detroit. It's the home of some of the world's most talented artists. It's where techno and Motown were born. It's a city where you can experience raw, untamed rock and roll. I'm Ben Rose, and I'm inviting you to join me weekday afternoons from 4 to 5 for the Motor City Juke Joint. I'll have interviews with musicians, info on what's going on around town, and a playlist curated by me just for you. It's all right here on newradiomedia.com.
We're back. This time we have Josh with us. Hi, Josh.
Hi.
Always so good to have you because you are the master of facials and all things that rejuvenate the skin.
Well, thank you for having me.
Oh, we're always happy to have you. Before we get to our celebrity segment, we had some questions that came in for you.
Oh, okay.
So, with the help of the doc here, let's see if we can answer some of these questions.
Okay.
Friend wants to know, sounds like it'll be my friend, that she spends a ton of money on skincare at Nordstrom's. And she asks, why isn't it working better? And Nordstrom's is a good store.
Sure.
And their products should be good. Why aren't her products working better?
Nordstrom has great clothes. Skincare, you know, I'm sure Doctor can agree with me here. It's overpriced and you're paying for the name. You're not paying for the quality of the ingredients. So I think that's really important to understand when it comes to terms of skincare. You know, you can shop there all day for clothes, for perfume, that's great, but when it comes to your skincare, you know, you really should be coming to a medical office to purchase your skincare to get something that's actually going to do what it should be doing for you.
So it's interesting. Some of the companies are under different names at Nordstrom's than they are for doctors. And so they'll prepare product just for Nordstrom shelves with ingredients that are not medical grade.
It's like we talked about watering down
Exactly.
Botox. And I hate to say that they water down their products, but we talked about this on a previous show, and I had a friend ask me if this is accurate, and I know it is accurate, but there's levels of skincare. What you
Correct.
buy at the drugstore, at CVS, is not the same quality as what you would get at Nordstrom's. But Nordstrom's is not medical grade like what you get at your office. So there is a difference in skincare products.
There is a difference, yes.
There's a difference. And the other interesting part about it is there's not much of a difference in price between what Nordstrom's is selling you and what we're selling you, and our product has proven medical grade ingredients that make changes. And you can get it basically for the same price as you would spend at Nordstrom's.
See, that's about the educational process of knowing what you're buying. I mean, some people swear by oil of Olay or Noxzema or the very low-end products because they've been told it's all the same. So just get the cheapest. But that's not true. And you get what you pay for.
Yeah, you get what you pay for. There are some good, inexpensive products, and that's something that we're honest about so that you can bring in your products, bring in your bag of products, and Josh will look through them, and he'll tell you what's worthwhile and what really you're wasting your money on. So yes, it may be $15 or $20, but it's $15 or $20 that you've basically spent month after month after month without results.
So you might as well just put mayonnaise on your face.
You might as well.
Because I have a friend that swears that lemon juice, she squeezes lemons, puts it on her face, and then uses mayonnaise and thinks it's the best. And egg whites to tighten the skin.
I've heard that as well.
And Preparation H.
Preparation H will help you.
So everybody has their own little home remedy kind of things.
Absolutely.
But there is no substitute for the medical grade products that you sell.
Correct.
So that's the answer that I thought you were going to say. Here's another one that says, since we're getting into fall and winter, do I still need to wear as much sunscreen?
This is
and
my
that's
favorite.
a tricky question, isn't it?
This is my favorite question. I get this almost on a daily basis. The answer is absolutely. It's just as important, if not more important. The sun is still out. You know, you might not believe it. Even here in Michigan, on cloudy days like today, for example, the sun is still out. And believe me, if you're not wearing sunscreen, you might not get burnt, but it's still out there and it's still damaging your skin. So it's very important.
So it's the UV rays that are there regardless of whether it's sunny or cloudy, correct?
UVA rays.
Yeah.
Because they say that even when you're driving in a car, you don't feel like it's coming through the glass.
Comes through the glass.
But it is.
Yeah, and that's why if you look at people's pictures, usually the left side of their face ages more because of driving.
Unless you're in England.
Then yes, you're in
Then
England.
it's the right side of their
Maybe
face.
you spend half your life in England and half your life here.
No, but it is true because that's the side that's always facing out and facing. So sunscreen should go under, if you're a woman, under your makeup.
Correct.
Every day.
Correct.
And for a man, just put it on after you get out of the shower, dry off, throw on some sunscreen.
And there are some excellent makeups that have SPF in them too. But again, it has to be the right product to protect the skin. And you've got to worry about both UVA, UVB. UVA is what's causing the aging. B is bad for the burn that it can create as well. And so you've got to protect your skin from both.
Well, I think it's important with winter coming up that we talk a little bit about the fact that winter has its other effects on your skin.
Yes.
That cold, dry air can dry out your skin, and you need more moisturizer in the winter, don't you?
Absolutely.
Yeah, definitely do. One of the things that I recommend, and you're talking about inexpensive things, get a humidifier right by bedside.
Really?
So even if you have one on the furnace, it's not enough for you at nighttime. You need one by bedside. It's going to help your skin. It'll also help your breathing. You'll probably have less colds as well. And so putting a humidifier right by bedside, a cold mist one, not a hot mist, because hot mist, if you're not cleaning it as well, can build bacteria.
Bacteria, right.
Yeah, so a
cold
mist humidifier right by
it's
bedside.
almost like a facial every night while you're sleeping.
Exactly what it is.
You know, you're just kind of freshening up your pores and making your skin look better.
It will also help with dry eyes too, that people get a lot of during the winter.
That's a great suggestion. See, if we hadn't talked about this, I wouldn't have known that. Now I'm going to dig out my humidifier. There's another question for you that says, my skin was always really oily, and now it's really dry. And that maybe isn't seasonal. That might just be a person's personal problem. Can that happen? Can your skin on its own change from oily to dry?
Absolutely, all the time. That's one thing I think people don't understand either, is the skin you're born with is not necessarily going to be the skin you have for the rest of your life. It can change throughout the year. It can change depending on, you know, things going on in your life, environmental factors, stress.
Stress. Now that's
anything.
interesting that you say that, because I've heard that when you're going through a stressful period of time and you're worrying and you've got a lot of internal, you know, stress and tension, it shows on your face. How does that work? I mean, how does it happen? Do your muscles react differently?
So when
Do
you're
you
under
stop
stress,
pumping?
you start building up cortisone. And cortisone, while it's helpful for you, you need a certain amount. When there's an abundance of cortisone, that can cause acne, can cause flare-ups for you too, make it more likely that you can get infections as well. And so the stress changes your cortisone levels, and cortisone works with your other hormones too. And that's what can create the changes for you in your skin.
So, that being said, what would you tell someone who just lost somebody recently to death, or is going through a divorce, or lost their job under a lot of stress? Use more moisturizer, use that, humidifier at night. What are some of the tips for people who are stressed?
Anything is possible when you're under stress. So I never want to tell someone the exact same thing as I may have told someone else. I think we all know stress can play a huge factor in all of our lives, and it can do a lot of different things to different people. So while, it may dry someone out, it may cause someone to be a little bit more oily. So we're not going to give them necessarily the exact same skincare regimen. So
for someone who is going through a stressful period, would you suggest a nice relaxing facial that might help their skin but also mentally relax them?
Come on in. We'll give you a good facial. We'll talk about what's going on with your skincare and what we can do to improve your skin.
Well, we'll call it the anti-stress facial.
And that's exactly what it is, as Josh says. So relieve their stress and then treat their skin condition, and Josh can customize their facial, whether it be a hydrofacial or one of his signature facials as well, with the ingredients they need at that moment.
To replenish what's missing.
Exactly.
Or take out some of the extra oil or whatever it is. Because the more oily your skin is, the more you get the blackheads and the whiteheads and all the things that we hate, right?
Right.
So I'm going to call that the stress-free facial. All right, here's another question for you. And this is kind of what I said at the beginning of the show. I didn't write this, though. But it says, I've accumulated a lot of products. What do I actually need? Should I go through and throw some of this out? Like, how many moisturizers can you have?
Right.
How many eye serums can you have? So how do we organize our drawers full of products that we don't use?
That's a great question. I think the first step, honestly, is to bring it in. Bring everything in. Come see your esthetician. Come see me, Dr. Berkowitz, and let us sit down with you and tell you what's worthwhile and what's not. And whatever's not worthwhile, get rid of it. It's not doing you any good sitting underneath your bathroom counter. We all accumulate so many products, over the years by going to different estheticians, different doctors, shopping at different stores, and one day we all take a look and we're like, wow, where did all this come from?
Guilty.
And
aren't there expiration dates on some of these
there
products?
are.
Like, I've probably had things in there for years. They probably dried out if I open the jar. It's probably
Yeah, if you have to crack it
That's
to
what
get
I'm
to
saying,
it,
right?
it's better just to
Yes,
throw it out than,
exactly.
than
So
to figure out.
is there a length of time that you should say, if I haven't used this cream in 6 months, get rid of it?
everything has a shelf life. So it's really important to take a look. There is a little symbol on every skincare product. It has like a little jar with a number on it. And that number tells you how long it is good for after it has been opened. So
it's not by the date
That's the
you
key.
purchase it. It's how long
Exactly.
it's been open.
Exactly. So we have to really take a good look at our skincare. If you haven't used it in a few months, maybe it's not good.
And especially the jars, once they're opened, what Josh said is key. There's an expiration from the time it's opened, and jars people will put their hands in.
Yes.
Oh, absolutely. You dip in it.
And so that becomes a petri dish.
Oh, God.
And
when I
so-
think about what's in my drawer.
Right.
Okay.
And so you're putting the product with bacteria on your skin at a certain point.
Oh, that's a terrible thought.
Yeah.
Another question about all these different products is a lot of people buy a lot of things, but they don't know how to use them in conjunction with each other.
Right.
Like, do I put eye cream on and then moisturizer from under the eyes? And do I put something, on my lips to keep them moist at night? How do I know which products to use? And if I have 5 skin creams and 5 moisturizers, do I alternate a different one every day?
Right.
How do we use these products that we have?
Yeah, it gets really confusing, especially when we constantly are just increasing the amount of products we're using. So again, you know, it really comes down to coming in, seeing someone who can help you. You don't need to know, you know, everything. Don't pretend to know, you know, come to us and we'll help you. We'll guide you and tell you exactly what you should be doing. So I think that's always the best thing you can do.
So do you suggest that a person find one product line that they like, get a good cleanser that they like and depend on, have a good skin moisturizer that they put on at night, one for night, one for day.
Yes.
Always put moisturizer under your foundation before you put it on your skin. And then use a separate eye cream or eye serum for the under eye area, separate from the lotion or the cream or the serum that you put on the face itself?
Yeah, I think that's perfect. You hit it, I mean, right on the head. That's exactly what you should be doing.
And what about those little sprays that you're supposed to set your makeup with, and it's like a moisturizing film?
Yeah, like a setting spray.
Right.
Yeah.
Is that good, or does that end up clogging the pores more?
There's some that are really great for the skin. There's some that are not so great for the skin. All in all, a setting spray should be very mild. It shouldn't contain a lot of ingredients. It shouldn't contain a lot of alcohol. You know, some of the best ones out there are just thermal spring water from Aven, which is a line we carry. You know, the more natural you keep it, the better.
I think the key is to take your products, go in and see Josh or Dr. Berkowitz, get rid of all the stuff you don't use, find the products that are best suited to your skincare, dry, oily, whatever, and stick to that, and you'll get better results than a drawer full of stuff that you don't know what to do with.
That's it.
All right, we're going to go to break, and when we come back, we're going to look at some celebrities again and try to guess what they've had done. We'll be right back.
It's all about you, and that's the way we like it.
Where you're going.
What you do to stay fit.
What you're eating.
What you're thinking.
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Detroit. It's the home of some of the world's most talented artists. It's where techno and Motown were born. It's a city where you can experience raw, untamed rock and roll. I'm Ben Rose, and I'm inviting you to join me weekday afternoons from 4 to 5 for the Motor City Juke Joint. I'll have interviews with musicians, info on what's going on around town, and a playlist curated by me just for you. It's all right here on newradiomedia.com.
Do you want to see things like this?
Did you just say you died?
Well, I mean, technically.
Or maybe even something like this.
We'll do nothing but destroy your corpses and burn them all for my dogs.
Your dogs are gone.
And sometimes, a little of this.
We need to have a talk.
I take my axe and I smash it.
No!
And check out Podquesters, the show where we tackle ghoulish goblins, fiendish foes, and dangerous drakes.
Oh, like the singer?
No, the dragon creature. Anyways, Podquesters, Fridays, only on newradiomedia.com.
Hi, I'm Art, and we're the crew at Tuffy Walled Lake. We've been in Walled Lake for 20 years, and through our knowledgeable staff and customer satisfaction, we've become quite the cornerstone in our community and to our discerning customers statewide. We know how important your vehicle is to you, and we take pride in our impeccable, affordable service, and we're trying to get you back on the road as quickly and safely as we possibly can. Please stop in and see why everybody comes from all over to get their car serviced at 784 North Pontiac Trail in Walled Lake.
I hope you're having as much fun watching this as we're having doing this show, because we're trying to teach you all the different ways that you can look great, and we're going to show you some of the celebrities. We do this every week with Josh, and we're going to show you some of the people who've had either a lot of work done or maybe just a little. You guess, and we'll let you know. Who's up first?
So
oh, my God.
So
oh my God.
It's funny that you say that, because this is one of the people who have had a lot of work done. This is the human Ken doll.
He doesn't look like Ken. He looks like an alien.
Exactly.
He looks like he's from a science fiction movie.
Yes. Now, I mean, I don't even know where you want to start with this, Dr. Berkowitz, but...
I think you start at the top.
Start at the top and work your way down?
So if you look at his hairline, I don't think he's done a thing with it. He's got a great hairline, and it's continued on. But he may have, being a bit older, placed some grafts. But his forehead is completely smooth, and so he's had Botox, but Botox to make him look like Spock.
Right.
Which is not a nice look.
Are you sure that's Botox, or did he have a brow lift?
He had a brow lift as well.
Oh.
But a brow lift alone is not going to get rid of every line for you. So this is a brow lift and Botox and causing the Mr. Spock look, which nobody really wants except, I guess, Mr. Spock. Then as far as his eyes are concerned, he may have had upper eyelid surgery, bringing his brow down even further, which was a big mistake as well. His lower lids have been tightened and his cheeks elevated.
That's like a feminine look, though.
Yes, yeah.
Right?
Yeah,
Only women have those kind of cheekbones.
And I don't remember the Ken doll looking feminine. I think the
No,
Ken doll was quite
no.
masculine. So yeah, that
Unless
cheek
Ken was gay and we didn't know it, but
may have been.
okay. But the nose, that's a whole different nose.
Whole different nose and not a very nice looking nose. But he obviously told a doctor he wanted it thinned out, and they did that for him. His lips, again, feminine lip.
That's a woman's lip.
Absolutely.
Yeah, that Cupid's bow is extremely feminine. But he did keep a strong chin. Too strong.
Yeah, but it's too. It's like that's a chin implant, isn't it?
Yes, it's a chin implant and definitely cheek implants. This is not filler alone. Plus, he had his buccal fat pad underneath his cheeks removed. It looks like as well.
So he gets that little hollowness.
Get that little
under
hollowness that's there as well.
He doesn't look like Ken.
No.
He looks like Kendra. I mean, that's a very feminine-looking man.
Yes.
And very plastic-looking.
Yeah,
I
I
mean,
think-
he looks like a wax museum.
Yeah, I don't think Barbie would be interested.
Oh, she's already turned him down 100 times. I mean, are you kidding? Okay, that's enough of Ken. Who's next?
So next we have Jennifer Aniston
Oh.
and Courtney Cox. Anyone who's a fan of the show Friends.
That's the one right there.
That's
Doc.
right
yeah.
here.
I said Demi Moore last week was from Friends. So sorry.
But they have, well, okay. So what have they had done?
So, we'll take a look here. This is obviously before they've had anything done for the most part, I would say.
They were young then.
Yeah, late 90s, early 2000s. They both have aged a little bit over the years differently. So we'll take first.
20 years, so yeah, let's see.
Let's take a look at Courtney Cox first. So
Courtney definitely had cheek filler and too much in the picture on the side over here, and she also, it looks like, had eyelid surgery with too much fat removed from her upper
Definitely,
lids.
because look how popped open they look.
Yeah,
They're
and,
like,
and so, right now when you do eyelid surgery, the whole idea is to leave fat. Fat is good, and just contour the fat. But when you remove all of the fatty tissue, you make somebody look older, not younger.
which is exactly what
are
happened.
these both around the same age?
Yeah, this is a couple of years apart, but still very close in age.
Because it doesn't look like she's done too much with her lips, right? Her lips still look natural, wouldn't you say?
Yeah, the problem is overfilled, and the eyelid surgery was a reduction of the fat, where she can, by the way, if she wanted to come see me,
right?
I can put fat or filler into her upper lid and rejuvenate that eyelid. So,
Demi, if you're watching, okay.
Courtney.
See, you got me mixing them up. Courtney. Okay.
All right.
So you can fix her.
Yes.
Okay.
Let's
With
take a look.
Donatella. We want to fix
Yeah.
Donatella Versace too.
Let's take a look at Jennifer Aniston.
Okay.
So, I mean, she's arguably one of the most beautiful women.
She looks great.
She looks great, and I feel like what she's doing is she's kind of embracing the aging process, but...
So I believe she's had fill to keep her
yes
youthful, some Botox as well, but very natural. I think she looks
I
great.
think she looks the best.
Yeah.
She doesn't have her lips overdone. Her skin looks shiny and beautiful and radiant. Her eyes look natural. She doesn't have the brow lift where they're way up. I'd say that's a beautiful woman.
Yeah, I mean,
What
she
do you say?
advertises for some creams that are out there, but this is not creams alone.
No,
No.
let us not think that it's just by buying her products.
Right.
Well, I hope everybody's learned a lot tonight about what products to keep, what products to throw out and which products to use on which part of your face. And believe me, if you want a good evaluation, go see Josh. Either you're in Sterling Heights. Do you ever go to West Bloomfield as well?
I do go to West Bloomfield.
Okay. He'll take a look at your skin, do an analysis of it, let you know which products are good and what kind of facial is good. So we're very happy that you watched tonight. I hope you learned a lot. And we'll be back next week with Accent Your Beauty with Dr. Mark Berkowitz. And we'll see you then.